Today we are going to discuss ventricular tachycardia. As the name suggests, this rhythm comes from the ventricles. If you recall, the ventricles are the third pacemaker of the heart after the SA node, the AV node, and then we head to the ventricles. As the name also suggests, it is a tachycardic rhythm, meaning it is fast. Ventricular tachycardia is an irritable focus in the ventricles that fires very regularly. When looking at the rhythm, it will be regular, meaning you will be able to march out your R to R interval. As far as your rate, it simply needs to be greater than 100 beats per minute. However, usually ventricular tachycardia is in the range of 150 to 250 beats per minute. Generally speaking, if we have a ventricular tachycardia that is between 100 and 150 beats per minute, it is often called a slow VTach. However, technically, it is still simply ventricular tachycardia. With your VTach, you will not see any P waves, they will be absent, therefore you cannot measure a PR interval. Looking at your QRS complex, it is going to appear wide and bizarre, and it will measure 0.12 seconds or greater. Something else to consider, if you have 3 or more PVCs in a row, that is considered a run of ventricular tachycardia. Something to consider with VTach is your patient, whether or not they have a pulse. With this rhythm, since it is organized and a single irritable focus within the ventricles, it is possible for your patient to have a pulse. However, it is also possible that your patient will not have a pulse, and then you would need to initiate a cardiac arrest. If your patient does have a pulse upon onset of ventricular tachycardia, keep in mind they may quickly deteriorate and become pulseless. Here is our first example of ventricular tachycardia, or VTach. When looking at this strip here, you can see the R to R interval is very regular. Everything is marching along. And glancing at it, your QRS complex looks quite wide and bizarre. We do not have a P wave or a PR interval. You can see this is our T wave here, our QRS, and then T wave when we're looking there. On this strip, the heart rate is 100 per minute. Your QRS is measuring 0.16 seconds, and this is a type of, or this is ventricular tachycardia. We have some additional examples. Looking at this strip, the rate appears to be a bit faster, however it is still regular when we're marching things along. And looking at your QRS complex, it is wide and bizarre if you're measuring your QRS. When we see this, it's a rate of 180. You have really nothing else you can see. This strip, you don't even see the T wave as we did in the previous strip. Your QRS is also measuring 0.16 seconds. If you wanted to further quantify this particular strip, you would call this, well, ventricular tachycardia or VTach, but you could call it monomorphic. Mono meaning one, morphic, morphology, or how it looks. So everything is looking the same. All of the QRS complexes are uniform. Our next example, we have something that looks a little bit different. It is still fast. You can measure your R to R intervals, and it is regular. We do see the rate is 230 on this one, and our QRS is wide and bizarre. This one you could call simply ventricular tachycardia, but to further quantify it, you could call this one polymorphic ventricular tachycardia. And that is because it has multiple morphologies of those QRS complexes. That is how we name it, polymorphic ventricular tachycardia. Keep in mind with any of your patients that may go into ventricular tachycardia, as with any rhythm, always assess your patient. Make sure that you are able to identify how they are feeling, what symptoms they may have. Patients that do maintain a pulse in ventricular tachycardia may not feel very well, especially depending on how fast the ventricular rate is. As in this strip, it's at 180. And the cardiac output for those patients is likely to decrease as their heart rate is increased. The heart has less time to fill and will become less efficient. Thanks for joining me.